But first, the Making Time in General Practice report recommends that a reduction in bureaucracy for GPs should be made a national priority in order to free up time for improvements within practices. The report found that 1 in 4 GP appointments is potentially avoidable. 1 in 6 patients could be seen by another member of the wider primary care team, such as a clinical pharmacist or a practice nurse. And an estimated 15 million appointments per year in England could be freed up if GPs were not having to spend time rearranging hospital appointments or chasing up test results from local hospitals. Rick Stern from NHS Alliance joins me now to talk about this report and the burden on GPs' time. What would you say are the main findings of that report?
Firstly, we need to make this a national priority, reducing the burden on practices. It's just not acceptable. The second is we were quite struck by how much time is spent both by GPs and by hospital doctors in terms of the failure for the two to connect up properly. So setting up appointments, setting up visits to hospitals, and then how they get discharged afterwards, the kind of drugs that people get afterwards. All of that takes up a ridiculous amount of time, both for GPs and for hospitals, and we need to sort that one out too. Thirdly, there's a lot that practices do. We have 8,000 different practices across England. They work in different ways. Some of them have brilliant ideas for sorting things out, and others struggle. And we need to share that better, and we need to put the support in place that enables practices that are struggling to learn from the best.
3 great examples. I mean, it's all really about freeing up GPs' time, isn't it, to create more space. But I mean, how really practical is that?
So how can they let go of some of these responsibilities and share them with others in the practice team, bring in different skill mix that some people have done so well, employ other staff within the practice, but also let go to people like pharmacists, community pharmacists or pharmacists working within the practice who have the skills and ability to take on so much of the workload that's currently carried out by GPs.
What response have you had from the NHS and the Department of Health, for instance?
Well, we've had a great response, I think in part because all the major primary care organisations have signed up to this report. So the BMA, the Royal College of General Practitioners and many other leaders in primary care have signed up to the forward, which gives us a real strength for taking this forward. We've also recently had the Secretary of State in his Health Service Journal lecture talk about the 3 things he's going to do immediately to respond to this report. So he has promised that he's going to introduce a genuinely integrated payment system. That's no simple task. I imagine that will take some time, but that's great news that we at least have a way forward on some of the mess and complexity in terms of the burden on practices at the moment. The second area highlighted is a very practical one about when, as patients, we are unable to make an outpatient appointment, that rather than simply having to go back to the start, he'll give a 2-week period to allow us to rebook the appointment and avoid yet more complexity and burden on GPs and hospitals. So that's a nice practical step for moving forward. The third key area that he's also pledged is paperless general practice by 2018. And again, a very tall order to deliver that. So what that really means is really good integrated IT systems, so that we can all share information in patient notes. As patients, we can see it. And that connectivity that as patients we assume is already there in the system and in practice really isn't. Putting that in place over the next 3 years will be a crucial step for making general practice manageable and sustainable and doable for people who are taking it forward in the future. And I think probably the biggest challenge of all for general practice that is culturally so used to having to take responsibility for anything and hold on to things for their patient and for the system as a whole is how they learn to let go and to hand things over to others and accept that there may be people who are better placed and better trained to be part of that solution. I think that's not an easy thing to do, and the cultural changes are always more complicated to embed than actually quite practical steps that could be taken to move towards it.
There seems to be a lot to be achieved, but thank you very much indeed for your time and your reflections today. It's been great to talk to you.
My pleasure.